My name is Angie Nichols, and today I would like to share some information with you about menopause. So what is menopause anyway? Menopause is the permanent end of fertility in women. It occurs as a result of inadequate ovarian function and is generally due to the aging process. It is a time of major hormonal change, and a woman no longer has a menstrual cycle for 1 year. Physical and psychological changes occur as a result of menopause, and the severity of symptoms vary from woman to woman. In some cases, it's a little harder to determine menopausal status, and that would be in the case of a woman that has had a uterine ablation, or if she's had a partial hysterectomy, because she would no longer be bleeding, but we need to determine are the ovaries still functioning or not. In those cases, further diagnostic testing is needed to ensure that estrogen replacement therapy is started at the appropriate time. At what age does menopause occur? Menopause can occur generally anywhere between the ages of 45 and 55, with 51 being the most common in the United States. It is influenced by many factors. Genetics plays a role in the reproductive health of women. So it's important for women to talk to the females in their family to determine what their experience has been with menopause or other reproductive issues. Anything that damages the ovaries could cause menopause to occur earlier, such as smoking, chemotherapy, or radiation. Women with thyroid disorders such as Hashimoto's disease or other autoimmune disorders generally will go through menopause earlier than women who do not have those types of disorders. So what are the physical changes that women experience during menopause? Well, the severity of symptoms vary from woman to woman. Some women may skate through menopause and not ever have an outward symptom. For other women, it is a very serious and life-altering struggle. I'm going to give you a list of things that women can experience. Not all women will experience all of the symptoms, but generally there is a redistribution of body weight. Women go from carrying the majority of their weight in their reproductive years from their hips, thighs, and buttocks to the abdomen. There's a loss of muscle mass. Women can experience gum loss, tooth loss, macular degeneration, vaginal dryness, dry eyes, headaches, hot flashes, night sweats, decreased immune functions, and experience an increase in allergies, osteoporosis, elevated blood pressure, insomnia. With the loss of estrogen, insulin resistance goes up, which is another reason that it is more difficult for women past menopause to lose weight. Our metabolism decreases. We can experience an increase in joint aches and pains, thinning hair, digestive problems, wrinkling and sagging of the skin, and loss of breast fullness. There are also psychological symptoms that women can experience, such as depression, anxiety, mood changes, memory lapses, decreased cognition, and difficulty concentrating. Women have described this to me as it feels as if they're walking around in a fog and just can't think clearly. There's a decrease in their self-image and poor self-confidence.